edema, always get a CT scan done. So my question is, what are you going to biopsy? This? But you don't know what it is. It's just edema. It's marrow edema and soft tissue edema. You can see that on the T2. There is no tumor. There is nothing here. What do you biopsy? Right? So you have to know what to biopsy. And so the simple rule here is any patient, right, who has unexplained marrow edema must get a CT scan done. And that CT scan will allow us to pick up occult fractures, osteoid osteomas, osteomyelitis, and sometimes unusual other lesions that present with unexplained marrow edema. So the innumerable number of times, our lives have been made better because we used the rule, picked up a pathology, and were able to give a diagnosis is immeasurable, right? So you need to follow this. Now, if you did do a CT scan, you would see this osteolytic lesion with the central ossific nucleus. We did a dynamic MR that also showed rapid uptake and washout of the lesion, so it confirmed the diagnosis, and that's how we picked up the osteoid osteoma. And again, osteoid osteoma is a missed diagnosis very often because this rule doesn't get followed, and it always presents with marrow edema when it is painful, but the lesion itself may not be very well seen. So second rule here, unexplained marrow edema in anywhere in the body, always get a CT scan done. Now, once the lesion is identified, we need to characterize it and figure out whether it's benign or aggressive. That's done with zone of transition and periosteal reaction. Zone of transition is the transition point between the lesion and the normal bone. So when it is very narrow and sharply defined, it basically tells us the biologic growth potential. So this is a very low biologic growth potential lesion, or a very slowly growing lesion, if at all, and therefore by inference it's a benign lesion. This is an aneurysmal bone cyst in an immature skeleton. But if you see a sclerotic rim, that is an even more powerful sign to tell us that we're dealing with a benign lesion, because it takes that much more time for the sclerotic rim to occur. Anybody? What is this? Cortical lesion, immature skeleton. It's cortical and juxtamedullary both.